Clay a co-op tea. Minutes of the previous meeting. Have we all read the minutes? Are we happy to approve them? Yes? No? Right, we approve the minutes of the previous meeting. Interests. I have no interest to declare. Any interest for the panel? No? No one with interest to declare.
So, Councillor Lawson, in relation to your interest with Calderdale Huddersfield.
Apologies, I am employed as a bank nurse for Calderdale and Huddersfield NHS Trust.
Thank you. Admission of the public. Are we going public? Are there any items that we need to have in private? No. All items will be in the public record. There are actually no members of the public present in the room, but we do have some officers. Do we have any deputations or petitions?
None.
None, thank you. There are no members of the public here. Are there any questions from public who may be online?
None received.
No questions received. Right, so the main item on the agenda is setting of the work programme for 2023-24. Now, we've lost Councillor Khan, yeah. We have the Cabinet member present, so perhaps Councillor Khan would like to comment, have any input on her priorities and the way she'd like to see things. Any comments to make?
Sorry, was that? I couldn't hear you.
Well, the microphone's on, so I can't. I'm not sure. Can you hear me now?
Yeah.
That's good. Right. It's a matter of just getting this set properly. Councillor Khan is the Cabinet member responsible for health and adult social care. And just invite Councillor Khan to make any comments or put any input to the panel on her priorities for the coming year.
Thank you, Councillor. We're just refreshing our priorities at the moment, but it will continue on a similar theme to ensuring that people have opportunities to address health and well-being, and for us to try and address health inequalities, and for people to stay as well as possible independently in their own homes. That's a broad theme of the priorities. Would you like me to comment on the Scrutiny panel's work programme, or do you want me to save that for another?
I'm happy for you to put any comments in that you feel appropriate.
Well, I've had a look at this, and it does overlap with our priorities. However, there's a lot of very important areas to look at. It is very ambitious. However, I am concerned whether you'll have enough time to really deep delve into each one of these, because it's, like I said, very ambitious, and these are complex areas.
Yes, thank you for that, Councillor. I have in the past said that I do personally share your concerns that we've got quite a wide scope of issues, and I am conscious of the potential problem of going too wide and not deep enough. I'm aware of that, and we'll be doing our best to narrow in on focus where it's appropriate. So we will do our best to meet that. Thank you. Has Nicola Bailey any comments to add or points to make? You there, Nicola?
Thank you, Chair.
Are you there? Sorry, I thought
Hi
you were
there.
online.
Yeah, it's fine. Hi, everybody. My name's Nicola Bailey. I'm the Assistant Director of Transformation and Partnerships at CHFT, and I'm here today representing Anna Basford and the Trust. I know that members from the Trust have looked at the work plan and fed in comments through the workshop, and so we're very comfortable with the work plan as it's presented in the papers today.
Yes, thank you. And we have Richard Parry. Would you like to add anything, Richard?
Thanks. Similarly, there's been the opportunity to input into the programme, and I think as other people have said, it's about getting that right balance between covering a lot of important issues, and there's a lot going on in the health and care system at the moment, being able to give them sufficient focus.
Thank you. And now moving online, there was Stacey Appleyard online. Have you anything you'd like to add, Stacey?
Hi everybody, it's Stacey Appleyard, Director of Health Watch Kirklees. I also have had chance to add comments to the work plan. I would like to say that there's no additions in terms of what I can add to the work plan, but I will be present at every scrutiny meeting to ensure that I'm bringing patient voice into those conversations as well at the time.
Yes, thank you. And I think it's very important that patients do have an input and do have the opportunity to input. Thank you for that. And also online we have Carol McKenna. Would you like to add any comments, Carol?
No, thank you, Chair. Welcomed the opportunity to be able to attend the previous meeting and think we managed to feed in everything then. So thank you for that opportunity. So there's nothing further at the moment.
Thank you. So essentially now we move towards setting the work programme for 23-24. Which, as has already been pointed out, is quite broad with a lot to cover. So, working through it, theme 1 is resources of the health and adult social care, Kirklees health and adult social care economy, and that's considering the resources of the system in Kirklees, including an overview of the financial position of local health and social care system and the works being carried out to meet current year budgets and, crucially I think, to identify any risks. Richard, would you like to comment?
Yeah, I mean, this obviously was discussed at the workshop that we had in June. We have kind of narrowed it down somewhat in relation to the original areas, but I think the panel did agree that they felt that this would be an important issue to cover early on in the work programme to give you that context and background to the challenges that are facing the health and social care economy. It is scheduled to come to the panel at the next meeting, which is in August. The brief has been effectively sent out now to obviously all partners, but clearly if there's any additional areas you feel that you want to highlight, or if any of our attendees wish to make any comments on that, then obviously that will be welcomed.
Yes, thank you, Richard. So do we have any comments on theme 1? Panel, we'll start with you first. Any panel members wish to comment? Hi, thank you. Have any of our guests any comment to make on that particular theme? And similarly, if anybody online who would like to comment on that? No. So I take yes, that's fine. Overview of financial position. I don't think any of us need to be told that times are, as we say around here, times are hard. Yes, there are going to be financial constraints for the council, for the health and social care system, for the NHS, for private suppliers as well. We do appreciate that. We also assume that other parties understand it as well. They must do. And we are going to have to be a little bit of the entire system, not this panel. We're going to have to be a little bit responsive. There's going to have to be an ability to work around issues that may arise, but we are aware of it. The risk to me is that anybody runs out of money, which could happen. The council is in straitened circumstances, the health services, individual private suppliers are. So moving on now to item 2, capacity and demand of the Kirklees Health and Adult Social Care System. And we're to monitor the work being done by the core physical providers to manage demand and catch up with delayed planned surgery, therapeutics and diagnostics, including receiving updated data on waiting list times by service. We need to be able to assess progress against data received by the panel last year. We need updates. We expect updates on waiting times for children requiring dental extractions, and we do have a letter about that at the moment. That's extractions under general anaesthetic. It's quite a specific subset of children's dentistry. Diagnostic waiting times, we need updates on those. We need updating on how different organisations are managing the waiting lists and what plans they have to reduce and catch up with delays in planned surgery in particular. And we need particular information about people waiting a year or longer, 52 weeks or longer. It's to be hoped that that's a very, very small number of people which will become zero rapidly. We want data on the cancelled elective or planned procedures. And we need to consider new developments and initiatives, specifically here community diagnostic hubs that are being introduced to address the backlog. We need to know as well if they are, as they are introduced, if they seem to be effective and how well they're doing to deal with things. But yeah, do you wish to add something, Richard?
Okay, so again, this is obviously picking up all the comments received from the workshop. And I think if you remember, when we talked about this particular item, we thought it would be helpful, again, to have that early in the discussions. So this has actually been scheduled to come back to the panel in August. So we'll have both the resources item and the capacity and demand item at the August meeting. I think the data was something that you were quite clear about that you felt would be helpful, particularly in relation to the comparisons to last year. And both of these items we're going to be looking to take, as discussed, a whole system approach. So we won't be receiving individual reports from each organisation. It will be presented as a whole system. There will be obviously individual data for each provider, for example, but it will be presented as a whole system discussion. I don't know whether any attendees have any comments before the panel themselves.
Please feel free if you have any comments. No.
I think it was just being clear on, sorry, thank you. It was just being clear on, we talk about waiting lists, which waiting lists, what type of elective or planned surgery, etc. Am I right in thinking this is just going to be a comparator with the data that we collected, so it's going to be like for like, with the addition?
What we've done is we've actually sent to, as part of the brief, the data that was submitted last year, so they will see exactly what the information was presented to the panel last year, and the idea was that they will do an update on that. Obviously, as Councillor Armour mentioned, there was that additional specific issue around waiting times for children requiring dental extraction, so that will be probably a new one that will be fed into that. But other than that, most of this really should be just like almost a refresh of this stuff, and that's because you wanted to see progress, really, see what progress had been made. And I think whilst we touched upon in the past around the diagnostic hubs, there wasn't an awful lot of information last time we covered that, but my understanding is that there should be a bit more progress. Is that correct, Nicola?
Yeah, absolutely right. We'd be happy to bring back an update specifically on the progress around the diagnostic centres locally and bring quite a detailed progress update on that. Yeah, no problem.
Thank you.
Yes, thank you. So moving on then to item 3, or topic 3, joined up care in Kirklees neighbourhoods. And this, we wish to continue to review the work of health services in the community, to include assessing progress of the integration of services and workforce, considering the work that is being done locally to action national delivery plans, and an update on the work of community pharmacy and the proposals from government and NHS on various price concessions reform and relief measures, because I think it's very widely known, very widely reported in the media, there are severe pressures on pharmacies, particularly perhaps the smaller units. So, who wants to speak about that? Anybody online would like to speak to that topic? No?
I'd just like to ask a question on that. So with the changes nationally to the ICS structures, locally, what impact will that have on Kirklees as a whole? I don't know if somebody from the ICS might be able to answer that.
I can, if that's helpful.
Yes, please.
It's potentially a really big question. Is it if it's specifically in relation to the sort of joined up care question? We've been running for just over a year now as an integrated care board, and the Health and Care Partnership has been established for that same amount of time as well. So we've seen some of the changes required in terms of governance, infrastructure and decision making arrangements operating for over 12 months now. When it actually comes down to localities though, and how our providers work together to deliver care in local communities, the formation of the ICB shouldn't make any difference. And I don't mean that in a negative way. It's because anything that should be done locally will continue to be done locally in the context of an ICB, just as it was, in the previous clinical commissioning groups. So if anything, I would say the formation of an ICB and the Health and Care Partnership is strengthening our ability to work together across our organisations, and that should be seen at neighbourhood level as well as sort of more strategic planning sort of level. Don't know if that answers your question or not.
Yeah, no, that's fine. I just wondered if that, from a local perspective, local sort of Kirklees perspective, whether that would have an impact on decision making, but no, that's fine.
It has changed the way we do it, but I believe in a positive sense, because actually it brings more voices into the decision-making process than was the case before.
Right, yeah, that's fine.
Yes, thank you, Claire. You actually mentioned the ICB, which is relatively new. Is it settling in? Is it starting to perform well?
Well, it's a year old. It had its first birthday on Saturday, 1st of July. So it's another big question. I think it is, but we have to remember that the West Yorkshire ICB didn't just sort of come together overnight. It was formed as a result of many years of partnership working across West Yorkshire. So the former CCGs, the providers, the councils, all of the other partners were used to working together and had got very much, all the sort of foundations established already. So even though the legal entity took effect on the 1st of July, we were already working in that way anyway.
Thank you, and happy birthday to the ICB.
Well, happy birthday to the NHS. It's 75 today, so
It
lots
is
of birthdays this
indeed.
week.
Let's hope it does another 75. Thank you.
We will come on to the actual agenda plan a little bit later on, but based, I think, on the feedback we received from the workshop, this has been provisionally scheduled for, I think it's for November. But we can maybe touch upon the work agenda plan after we've sort of agreed the outline work plan. But certainly at the moment it's provisionally scheduled for November.
Yes, thank you. Topics 4 in mental health and well-being. Several panel members and I had a meeting, and it was interesting to say the least. It was an online discussion, we held it yesterday, and it included health scrutiny counsellors from Wakefield, Calderdale and Kirklees, along with officers, and were addressed by NHS service providers from the geographical area. And the topics are potentially wide-ranging reconfiguration of services for those diagnosed with dementia on the one hand and other mental health conditions on the other. And an emphasis was on inpatient care for those people. And to summarise, it became clear that inpatient service provision in this geographical area and also in the area of clinical need has been for some years suboptimal. They accept it's been suboptimal. It's often been the case that the two classes of patients have been treated on the same wards, and then staff noted that this was not in the best clinical interests of patients, and it was also said that it was not good for staff morale because different patients with different needs need different approaches, and there's a danger that patients with a depressive illness and patients with dementia do not necessarily mix well in a close social setting like a ward. It's also made clear that there are still several mixed-sex facilities still in use, and the service providers spoke of their aspirations to bring about change regarding both premises and services, and informed us that they're working towards a consultation on any change to service provisions, which would by its nature be quite wide-ranging. They expressed confidence that capital funding would be available, but they did not open up the topic of revenue funding for wages and other operating costs. In common with much of the health service, I'd say it's all of it really, it was noted that there are pressures on staff recruitment and retention. Whilst the service providers were clear that they aspire to change their delivery model, they did not present any range of options. Instead, it certainly appeared to me that they had largely a single view of the direction of travel they wished to adopt. In the absence of the service providers, counsellors and council officers discussed what approach to take. There was a very clear consensus that, given the geographical spread of the service provisions, it looks as if a joint scrutiny approach was warranted in this case. Council officers from each affected authority are to work together on preliminary preparations for this. And I don't know whether Richard would like to add to that as an officer perspective.
Yeah, thank you. Thank you, Chair. Right, so this particular item, mental health and wellbeing, is effectively split into two elements. We've obviously got the element around the proposals for transforming older people's mental health inpatient services, but we've also identified some work around looking at the work being undertaken by the Kirklees Integrated Wellness Service and the single point of access with a focus on CAMS. So we do need to bear in mind there's two elements here to this particular item or this particular area. So in terms of the transformation of the older people's mental health inpatient services, then as Councillor Armour has described, and I think we have three of our other members were also present, weren't I think Councillor Zadie, Lawson, when Imran were there, weren't you? So you heard the or saw and heard the presentation, it is clear that whilst there was very little in the way of detailed proposals that was obviously presented, that when you look at the challenges they've got, if you look at the vision that they have, and if you look at the criteria for development, I think there was a broad agreement across all three local authorities that this is likely to be a substantial or significant change to service. And because obviously it will likely have an impact across those 3 local authorities' boundaries, then there would be a requirement to establish a mandatory health scrutiny, joint health scrutiny committee. So in terms of the process, the proposal will be is that each local authority will follow their own internal process for establishing a JOSC. And what that will mean here is that we will probably have to bring to the panel, formally bring to the panel, details in terms of the challenges they're facing, very much in line with the presentation that you got yesterday, for the panel to make a decision as to whether, on the basis of the information that you've received, that you consider that it's likely to be a significant change of service, because we need to get the ball rolling in order to be able to establish a JOSC for the kind of timescales that they were talking about. So they are talking about coming back probably around September/October time with some kind of details on the proposals, with consultation likely to take place in the early part of 2024. So if we do go that line, then it will mean that for August we've got obviously 2 quite substantial items already on the resources and on the capacity and demand, but we'll probably have to add to that the item around the transformation of older people's mental health inpatient services. It doesn't have to be a long item, but we do formally need to, or the panel will formally need to reach a decision on that. And following that, we will then have to go to the Overview and Scrutiny Management Committee to present to them, because they will, the process for them was they would formally need to appoint members to that particular JOSC. So that's the process we're going through. I think, Councillor Smaid, did you have your hand raised? Did you want to come in on this?
Yes, but you picked up the point I was going to make. So the panel needs to establish whether it's substantial in their view, and then we need to have time to go to OSMC to be able to establish our part of any joint health scrutiny panel for that work. Thank you.
And just to sort of reiterate one of the points that Councillor Armour made about the proposals, we have made it clear. I wrote to the lead from the ICB yesterday, who's overseeing this particular transformation programme, to make the point that the comments from members was quite clear that they would want to have some input into the options that are being developed, so you don't get a fait accompli, so it's not just presented to you and saying this is it, and also that you would want input into the development of a consultation plan as well. And I can confirm that they have written back and agreed that that is the approach that they would like to take. So I think that's helpful from a scrutiny perspective, that you will have that, or members of that JOSC will have that opportunity to have that input. So that's the process for that element, but obviously we still need to just confirm that we're still happy in relation to the other part of the mental health and wellbeing issue, whether you're still comfortable that's another key area of focus for you to consider at a future meeting.
Yes, thank you, Richard. So, I don't really need to say much more than that. The mental health and wellbeing is quite a broad area. We're looking at work being undertaken by Integrated Wellness Service, Thriving Kirklees and CAMS. So what do we think about that panel? Are we happy that we've got enough going there? Do we want more? What do we want? Over to you. Yes, no comment was the answer. Just wondering if our colleagues present in the room have anything they would wish to add to that. And similarly, if anyone online would like to make a comment. Right, thank you. So we're happy with that. We we are facing a significant change in provision, hopefully for the better, but we need to keep a close eye on that as a scrutiny panel. Theme 5, managing capacity and demand. To look at the work that's being done in the community to reduce unnecessary admissions to hospital, including considering actions and initiatives to support hospital avoidance and providing the appropriate level of care and support at or closer to home. Looking at work being done by the local authority and Locala on providing reablement support to include work being done pre-discharge, during discharge and post-discharge. And I think a big issue there has been the revolving door where people are discharged and then readmitted within, sometimes within hours, but certainly within days. And to review the data on the number of discharges and readmissions up to 28 days from all healthcare settings over the last 12 months. Have you anything to add to that, Richard?
Thank you, Chair. Yeah, if you remember, this originally was presented as unplanned care. And this was very much to continue the work that the panel had done in the past by monitoring the work being done within the local system to manage periods throughout the annual cycle when there were capacity and demand imbalances. And previous to that, if you remember, there used to be like a winter pressures discussion. But as we've already discussed on a number of occasions, that you know, whilst there are pressures during the winter, and obviously they can be exacerbated around specific issues, the system is running pretty hot, we would say, all the time. So when we had that discussion, it kind of started, the emphasis seemed to switch to more looking at what work is being done to reduce unnecessary admissions to hospital. So it's kind of, whilst we had that focus initially around looking overall at what's been done to manage periods of capacity and demand imbalances, it's kind of switched, and the focus is very much more now looking at the work that's been done within the community to support hospital avoidance with those additional elements of work being done around discharge. So that's kind of where we're at. So I don't know whether Nicola or maybe do you have any specific comments around this particular item, because I don't think you were here for that discussion.
I think you've probably summarised it well. Richard, we'd be more than happy to bring a conversation with partners, I think, here, because you've outlined quite clearly some of the challenges that we've got, and it's not just a seasonal, typical winter challenge anymore. There's variation throughout the year. So yeah, more than happy to participate in that with partners in the system. Thanks.
Yeah, any further comments from the room first of all? No. Any further comments online? No, thank you.
Can we just confirm with the panel, is the panel okay with what we've got on?
Yeah, well, as a panel, anything they wish to add on that theme? No, thank you. Right, theme 6, maternity services. I think we'll start with a report that have attended a meeting on the 22nd of June. Officers and I met with senior Calderdale and Huddersfield Health Trust staff. They were the Deputy Chief Executive and Head of Restructuring, one person, the Chief Nurse and the Head of Maternity Services. We discussed the reopening of birthing facilities at Huddersfield Royal Infirmary. We are, and I believe it is in process now, I'm hoping to arrange a similar meeting to discuss maternity services in Dewsbury. Because as it stands, children can't be born, unless they're born at home, they can't be born in Kirklees at the moment, which doesn't seem right. The Huddersfield service was suspended in March 2020 as a temporary response to COVID pressures. and it has not since reopened. I stated that were this closure to become permanent, and it's a moot point as to when a 3-year temporary closure becomes permanent, this will be a significant change to provisions requiring a formal consultation process. I was informed that home birthing continues to be an available option for Huddersfield women, but that the rates of take-up of this are low, in fact very low, as it was put. At the opposite end of the scale, so to speak, consultant-led services are and will continue to be based in Halifax. There are concerns around recruitment and retention of midwives and other staff. Again, this is a recurrent theme, and we do appreciate the difficulties, which impinge directly on Huddersfield services, although a similar picture applies in much of the country. Recruitment is competitive, and of course, existing staff are free to leave. Nonetheless, senior management are hopeful that a move to regional recruitment will help ease pressures, and they noted their hopes that the March 2024 cohort of newly qualified midwives will be persuaded to apply locally for placements. They voiced an aspiration to reopen the Huddersfield birthing facilities in summer 2024, but could not give a firm assurance that this would be met. And they have moved to what they're calling a responsive model of staffing, which means that they hope to have staff who can be moved from one base to another as needs arise in a particular centre, whether it's Huddersfield, Halifax or wherever. And this topic's on our work programme. The comments above indicate that we may need to consider the timings of our discussions. So have you anything to add, Richard?
Thank you, Chair. So as Councillor Armour said, it's obviously been an issue that's been on the programme for a while now. We have written letters, as you know, to the chief execs of both trusts. And as Councillor Armour just referred to, we have had a more recent discussion with Calderdale and Huddersfield Foundation Trust. We are looking to provisionally, subject to your agreement, have a meeting scheduled for discussion for the panel for its November meeting. And the reason we're looking at the November meeting is that they think, following the recruitment that will take place in September, they'll be in a better position to sort of give a little bit more of an update in terms of where they're at. They did talk about providing a responsive model, although I'm not exactly sure what they mean by a responsive model. I think it's a similar model possibly to the one that's been done at Calderdale Royal Hospital. But we have asked as part of the brief that they provide a bit more detail of how that model would work. And there's obviously more detailed briefs around sort of the timeline for the proposals to sort of reopen in summer 2024. We're also talking about, at that meeting, possibly having a second item which we'll come on to around some of the work that both trusts are jointly working together on. So I think that meeting, if we were to go ahead with that, will be very much focused around sort of the cooperation that's working between the two trusts in terms of some joint services. Just whilst I'm on the subject of this, we have had a formal invite from Mid-Yorks to have a similar sort of discussion, but also they have extended an invite to the panel to visit maternity services at Dewsbury and Pinderfield. So again, that'll be something that, you know, if you feel that is going to be of value, then we can arrange that for you. So we could have a visit to the Dewsbury and the Pinderfield site and have an informal discussion prior potentially to this item coming in November. Very similar format to those that attended the one at Calderdale Royal Hospital, which I know those members who went felt was helpful. Nothing more to add on that.
Yes, thank you, Richard. Have we any comments from panel members, please? Yes, ma'am.
Yeah, I think the timing is very important. They've suggested that they could get the recruitment going in September, but if they haven't quite started to make inroads, I'd like to know what they're doing to push for March, how they're selling our patch, how are they going to make people come who've trained in Leeds to here when they've established themselves over there. So I think that'll be really important. And the firm detail on what this responsive unit's going to be like so we can look ahead. It's really important that we have birthing facilities here, midwife-led, supported in hospital. It's the way people are used to having the babies these days. And, I really don't want to see us lose that facility.
Yeah, yes, thank you. I agree that there are areas of vagueness. There are areas of vagueness at the moment. Yes, Councillor Smays, you have your hand up, and I know you need to leave soon, so would you like to comment?
Okay, thanks ever so much. As you know, Chair, we have raised this previously in last year's work programme, and looking at the information, we're now a year, we would be in October, we would be a year after the panel asked for a plan and an outline of the proposed service model. So I think it would be good to get both trusts together for them to give the panel their plans and a proposed service model as was asked for previously, because that doesn't look as if it is still available. And then the panel will need to consider whether there is a plan in place or whether there needs to be some further work on that. I think that this has been ongoing for quite a little while now, and as a scrutiny team, we need to have full information from both trusts on how they propose to move forward. Having been involved in both reconfigurations previously where maternity services were involved, I understand the complexities of this, and we also understand the complexities of the changing picture in maternity as well as recruitment. But we have asked previously for an outline of a proposed service model, and I think that this should come to scrutiny as soon as your work plan can accommodate that. Thank you.
Yes, thank you. I wouldn't wish to be unkind, but I think the word plan is a little bit strong. It seems to me more like aspirations here, but I certainly take your point about timings. Thank you very much. Are there any panel members wish to say anything? Yes?
I actually think a visit to Dewsbury would be, to Mid-Yorks would be actually quite a good idea. If there isn't any midwifery-led sort of services at Dewsbury, I can't see the point of us all rocking up to Dewsbury District Hospital. And I would suggest that we actually just went to Pinderfields, unless they sort of say, we've got this, this and this in place.
Yes, I take your point there. There could be value in attending Dewsbury to see what physical facilities they have that they could put back into use, but I do take your point about if they're not actually using the services, the facilities, what can we learn from it? I do take that point. Were you wanting to add anything?
No, I've just said I've noted that, and what I can do is liaise with the trust to get a clarification around what they would like to present to the panel, and I'll make the point about the Dewsbury site as well.
Thank you. Any more? Yes, Bev.
As far as the visit goes, I mean, it may be possible that we can then draw a comparison to what people have got that we don't have anymore here, that we should be looking to resurrect. That might be useful. And I know, because I wasn't here when you took the previous visit, that I would really like to go and see what is available elsewhere or further afield and what we're left with here.
Yes, thank you. My impression is that there's not a lack of physical facilities, there's a lack of staff. That's my impression. It's set off as COVID, but it's become a staff issue now, a short staffing issue now. But I take your point, thank you.
I think in terms of a visit, what I did find previously when we went to Calderwood, it was really useful to talk to the staff on the ground, because sometimes you hear things from the staff that you're not necessarily aware of in other routes, and just, you know, what's it like where you work, how are things happening. So I think it's quite useful to actually, if nothing else, to talk to the staff on the ground and understand how they're feeling in terms of the pressures that they're experiencing, what their perception is.
Thank you. That's actually a vote for going to Pinderfields, because presumably there's no staff at Dewsbury. Yes, thank you. Any more? No, we any input from our colleagues who are present?
Thank you. Thanks, Chair. I think you've summarised the dialogue that you've been having recently, certainly with CHFT, really well, so I'm not going to go back over that. We'd be more than happy, obviously, to continue the dialogue, and if members feel that it would be helpful to have a visit to Calderdale to look at the facilities and speak to our colleagues, we'd be more than happy to organise that. And obviously happy to come back with colleagues from Mid-Yorks as the work plan allows, in terms of progressing those discussions, sharing those plans. Thanks.
Thank you. Are there any more comment from online joinees? No, you all right there, Richard? Right, thank you. It looks as if we're going to try and organise a trip to, and it would, I think, would have to be Pinderfields. I don't see much point in going to Dewsbury under the circumstances. So we'll drop that on the toes of the officeriat. Thank you, colleagues. Theme 7, access to dentistry. And this is a very wide-ranging topic, actually. So there's a specific point to follow up on the concerns of the panel regarding significant delays for children requiring dental extractions under general anaesthetic. And that's to include an update from Locala and the two trusts on the actions being taken to enable the availability of appropriately staffed theatre time to support the management of the waiting list, and seeking an input from the West Yorkshire Integrated Care Board to include its response to the delays as the new Commissioner of Dental Services in West Yorkshire. So there's that specific one, and we do have letters about that. But there's also a broader topic, and I don't want us to get too broad and shallow, but access to dental services does seem, or lack of access to dental services, does seem to be a bit of a national issue as well, a lot of a national issue. So this is actually specifically children under general anaesthetic, but there's also the broader picture. I think, can we just start with health service colleagues? Carol, would you like to comment on that?
Yes, I think you're right. I think, Chair, there's two elements. There's the issue that had been flagged in your previous conversation about access to theatre space and theatre capacity for children. My recollection of the earlier conversations is that we said it would be helpful to pick that up in the capacity and demand section. In fact, I think it is there in the work plan. So rather than having it specifically under a dentistry item, pick it up more in the ongoing planned surgery conversation under the capacity and demand slot. And then we could take the access to routine dental care as a separate item at an appropriate point in time. I think the ICB has only just taken on responsibility for this, and obviously we wouldn't necessarily expect any, significant improvements overnight. I think we've probably been quite realistic on that. However, we could schedule something maybe for later on in the annual programme to give an update on how things have progressed since the ICB took that on, if that would be okay.
Yes, thank you. I'm not sure just how we can work it through our system, but I do take the point that when we're talking specifically about extractions, children's extractions under general anaesthetic, it could fit into a different section of the the work plan, so I'll just ask Richard if he'd like to comment on that.
Yeah, thank you, Chair. Yeah, we included it predominantly because it was an issue that the panel had raised and wanted to obviously follow up on. Carol's absolutely right. When we had the workshop discussion, we talked about having that element of data included as part of that discussion. So that will certainly give panel members sort of like an update and a feel for how things are progressing. As you said, Councillor Armour, we've received a letter from the ICB that has highlighted some of the specific responses to this issue. They've talked about additional funding to community dental service providers, initiating work to review the pathway and optimal service model for general anaesthetic. So there's obviously a number of strands of work that is actually being undertaken by ICB, and obviously, as Carol has rightly said, obviously it's only just started, so it would seem sensible maybe to have a look at the data, have a sort of general discussion at that point, and then maybe at some point later on in the panel's work programme, come back just to sort of maybe get an update in terms of the work that the ICB have specifically highlighted in its response letter.
Thank you for that, Richard. We colleagues wish to comment further on that? No. Panel.
Thank you, Chair.
Yeah.
Sorry.
Oh, my apologies. Yes, please.
Miss Mand. Just to confirm, I agree with Carol's proposal, and I think it would be more than happy to share the updated information as part of the data on item 2, and then we can pick up specifically if there are queries from that once that's been shared with the panel. So I think that sounds like a positive way forward.
Right, thank you for that. Panel, any comments on this topic? Theme? No. Thank you. So that's ongoing, and we will be addressing it as we move forward. Theme 8. Kirklees Safeguarding Adults Board and the Care Quality Commission. To receive and consider the Kirklees annual report in advance of discussion with the independent chair of that board, and to enable the panel to identify areas of concern and or interest. Receive a presentation from the CQC, the Care Quality Commission, on the state of care of regulated services across Kirklees, and to arrange a discussion with both the Kirklees Safeguarding Adults Board and the CQC to help provide the panel with an overview of the quality and safety of adult social care provision. And this is a very important topic to my view, because as you get older you start worrying a bit more about adult social care. I'm just wondering, Richard, do you have any comment to make on this?
So this is an item which comes every year, but I think it's helpful to demonstrate that this panel's got an understanding of what's happening in the safeguarding system across Kirklees, which involves obviously the local authority, NHS partners and independent care providers, and can hopefully seek assurance that those arrangements are in place and working well.
Thank you. Were any more comments from within the room apart from the panel? Anything you'd like to add? No. Anybody online? And this seems to be thinning out now. Anybody online wish to add any comment to that? No, thank you. Right, panel, what do we think? Anybody wish to start? Right, I think that's fine, because this is one of those items that we're to receive and consider reports, so we do have to receive and consider reports. We can't really alter that, and we don't want to alter that. So we'll just leave that as it is. To some extent, I suppose the timing is going to rely on when the reports are available for us to receive. Item 9. Adult social care. Again, this is one that as we get older we get more worried about. To continue to focus on the services being delivered by Kirklees Adult Social Care. including considering the new CQC inspection areas of responsibility. We need to understand the assurance regime. Looking at the Council's approach to preparing for the CQC inspections, to look at emerging themes and outcomes from the pilot inspection sites, workforce challenges, and in common with the NHS, private sector and indeed public sector, but private sector providers in this area certainly do seem to face workforce challenges of recruitment and retention, and to receive details of the broader range of changes that the Council is developing to improve the social care offer. This is a topic that I have raised with Richard with a different hat on in the past, and I think, Richard, would you like to comment there?
So CQC have obviously published their intention to start to inspect local authorities. They're going through a pilot stage over the next 3 months or so. So this is probably an item for the second half of Q2 of this year, so probably a kind of November, December item, because we should by then have feedback from the pilots, and indeed CQC will have started by that stage their kind of first formal inspections.
Yes, thank you. Just wondering, are there any immediate pressures within the care provider system, private providers working for the council, so to speak? Are there any immediate?
I think it's a continuation of the long-standing challenges around social care workforce. So you'll see in the nationally published data that talks about 160,000 vacancies, significant turnover rates, so turnover rates, 20-30% not untypical. Particular challenges often in the nursing home sector, so if the NHS finds it difficult to recruit and retain a nursing workforce, that's doubly so generally for nursing home providers, where actually the expectation is often those nurses are working in a much more isolated way than NHS nurses are. They're not part of a big kind of team in a hospital setting or in a district nursing setting. And we know that there's probably been a level of uncertainty about the national policy landscape for the last few years, with providers and local authorities preparing for social care reform that would have gone live in October this year, which is now pushed back to October 2025. And in a sense, a number of elements of that social care reform would have started to address those issues that have been flagged. In particular, it's published nationally, there's a, I think, £500 million workforce fund that's been reduced significantly in terms of its scale, and we're not yet clear how that will be deployed to support the social care workforce. So I think, in a sense, it's probably nothing. Had we been having this conversation 5 years ago, we'd have probably raised some fairly similar issues. Had we had this conversation 3 years ago, we'd have probably raised some fairly similar issues. I think what's happening is probably a greater sense of instability increasing and resilience in the market decreasing. So in each of these conversations, the conversation is not any different of that 5 years, but probably the level of risk has grown each year.
Thank you, Richard. Carol, have you any comments on this? Online?
Sorry, Chair, did you ask me?
Yes, I just wanted online if you've got any comments.
No, I've nothing to add. Thanks, Chair. I think Richard's covered everything.
Yeah, thank you. Panel, we got any? Oh, Bob, yes.
Would it be possible, if there's a pilot starting now and we're going to look at some outcomes of that in, say, 3 months' time, to have some documentation about what that pilot entails, so we can have a look at it in advance, and then when we see where it's gone in 3 months, we know what was intended and where it might have reached?
Yeah, I think we will be dependent to some extent on the CQC about when they've got the data that we could look at. And Richard.
Shall I come in? So CQC looked for 5 local authorities that they could pilot the new inspection approach in. The nearest to those is North East Lincolnshire. So we those pilots, the start of those pilots has been slightly delayed. So what we will have is feedback from CQC in due course about what they found through those pilots. We may have some more informal feedback through talking to colleagues, for instance, at North East Lincolnshire, but that will be kind of more informal. It will not be a kind of set of formal feedback from CQC. But the sector anticipates getting feedback from those from CQC about what they found through those 5 pilot sites later in the autumn. So they've just started the work now, so I think it will be kind of September, October time.
Thank you, Richard. Do you have anything to add, Richard? My apologies, Bev, sorry.
Sorry, as a new member of the panel, maybe I'm missing something that was informed about last year. What I was interested in looking at is what is being done in the pilots before we see what is it that they're doing, so that when we get the results or the outcomes, you know where they've come from, rather than going in cold to a meeting and having everything all at once. So, you know, so you're looking at the outcomes, knowing what's being done in these pilot areas.
Yes, thank you. Richard, would you like to respond?
So if it's helpful, we could share some background about the overall approach to CQC assurance. We've got some slides that we could share. At the moment, there's not absolute clarity about what CQC are looking for through those pilots that we could share and say this is the intended methodology. We know broadly the areas that they're going to be testing out through the formal inspection regime. I think I'm less clear at the moment which of those they're testing out through the pilots, or whether they're going to effectively test one element at each of the pilot sites. But we can certainly describe a bit about what we think it will look like in September post-pilot, because CQC have indicated their intended approach.
Thank you, Richard. Are you happy with that, man?
Sorry, if there's a pilot going on, there must be a structure to it. So I don't understand what's being piloted. I'm sorry, it's being new to the panel, I don't know this. So I would like to know what is being piloted. So when it comes for the results, I know what it's been looking at and I know where it's coming from.
If you could, Richard, please.
Sure, I think CQC haven't published and made publicly available the full detail of their pilot approach. They're obviously working with the pilot sites on what that looks like, so we will have some insights, but and we can certainly keep looking to see what CQC have published in terms of their approach. But they will look, I think at this stage, they were very much seeing it as a pilot approach. We know, though, at a high level what they intend to look for and the approach they intend to adopt through, subject to the kind of outcome of the pilots, for the kind of the formal inspection regime. So I think you're right to say it's really helpful to understand the proposed methodology, or the pilot methodology, was X. It looked to test out these 5 things. What it found was these. We don't have that level of detail at the moment from CQC.
Thank you. Any other panel questions, points, queries? No, thank you. Anything to add, Richard? Right, thank you. So, moving on. And this is the item, or theme, sorry, 10. And this is joined up hospital services in Kirklees. To look at work being developed by Colesdale and Huddersfield NHS Foundation Trust and the Mid Yorkshire Teaching NHS Trust to provide joined up services in Kirklees, to include the approach to delivering non-surgical oncology services for Kirklees residents, the approach being taken to develop the partnership working between the 2 trusts, including details of other services that have the potential to be jointly delivered and or supported. And on that last point, there has been talk about they might be able to get a joint initiative on maternity services going, but that's very much in the aspiration field at the moment, but it would appear to be a sensible approach. To me, as a layperson, it would appear to be a sensible approach. Not sure how far they'll get with it. Any Carol's still there, Carol McKenna? Have you any comment on that, Carol?
Not specifically on maternity, but I think where we got to with this conversation was that we felt it would be beneficial for the panel to hear from both trusts in the room at the same time, particularly because there were a number of areas where we were able to hopefully provide some helpful examples of where the two providers were working together for the benefit of Kirklees. So there's programmes around things like the Community Diagnostic Centre. I know we did talk about maternity, and there was a couple of other areas as well. So there was something about trying to bring them together in the round so that panel members could get a sense and hopefully some assurance from hearing from both acute trusts together with a bit of a Kirklees focus. So I think that was what the intention of the item mainly was.
Yeah, yes, thank you. I didn't intend to mislead you. I'm not looking for a focus on maternity services. Just taking as an area that could benefit from a combined approach. But I take the point, this isn't maternity services led.
No, but you're absolutely right in that I know that the trusts are in dialogue about maternity services. So it was an example of one where a working together approach might yield benefits in the same way as it does in other areas. So I think we thought it would be helpful to bring in a few examples into that item.
Yes, thank you, Carol. Sorry. Nicola, you.
Thank you. Yeah, I think we'd support bringing some examples to committee of how we're working with colleagues in Mid-Yorks on various different areas, a couple that have been mentioned already, so the non-surgical oncology work that we're doing with Mid-Yorks, and of course the community diagnostic centres, which we're working in partnership with Mid-Yorks on, and maternity and a number of other things. So yeah, I think hopefully that will be helpful to bring some examples of some of that work that we're doing in partnership.
Thank you. Have you anything to add, Richard?
Yeah, just to confirm that this was partly touched upon at the discussion we had with the trust around maternity services. We talked about this at the same time. And so the proposal is when we bring back the specific issue around maternity services in November, that we would have this as another item, so we could look more widely at the work and the collaboration between the two trusts. So I think that will be helpful for the panel then to get a sense in terms of other areas of work that are being developed for the benefit of residents of Kirklees.
Yeah, thank you. Panel, any comments?
Yeah,
yes,
I just wanted to add to that. So interestingly, it says that you look at the approach of joint working and working in partnership across the two trusts. What would be really interesting from our perspective, from a panellist perspective, is to look at whether any audits been done or any hard and fast figures for different services to see where the improvements actually happened, whether that's improvement in elective cases or surgery. So to look at the different departments that have utilised this cross-working and partnership and see if there is actually a difference and an actual improvement in the level of services and the level of throughput of patients. I don't know if that exists or whether there is ongoing audit to evaluate that.
Well, we haven't asked that question, but I don't know, Nicola
But it's
might be
worth
able
asking
to
if
comment.
that, and it might be, I suppose, directed at individual services and when they come in and speak to us individually to have that data at hand if it's available.
Yeah, we can certainly do some work and ask the questions. So I think some of the items that we've talked about on the work plan here around surgical oncology and community diagnostic centres and maternity are almost forward-looking, aren't they? And what you're describing is, have we got any evidence of any partnership working that we've already got or done that we can evidence true benefit from? So that's certainly something we can have some conversations about and bring forward as well. Yeah, no problem.
And just following on from that, I suppose the other thing that is really important that we don't deviate away from is the impact that it will have on those service users. So from our perspective, residents, and in terms of where they're accessing those services and some of the logistics around that, transport costs, time, capacity.
Yeah, thank you. Any more points? No. Nothing that colleagues would wish to raise? No. Thank you very much. So we're now looking at item 11, are we not? Oh, theme 11, sorry. The external consultancy. And Adult Social Care has recently instructed an external commission consultant to support the identification of pathway and demand efficiencies. The commission will take the form of an exploration analysis stage and then a potential change programme of work to embed efficiency opportunities. And I don't know a great deal about that at all, I'll be absolutely honest with the panel. Richard, would you like to enlighten me, please?
Shall I come in? So we've appointed an organisation called Newton Europe who've done a lot of work in health and social care space. And we're asking them to do three things. One is to help us build a better understanding of what social care demand is going to look like over the next 5 years. So if we look at the patterns of demand are feeling different to, say, 3 years ago. And what we want to understand is how much of this is the impact of COVID. So, and is this a temporary change in the patterns of demand, or has there been a shift because of COVID? So a hypothesis could be that there's a number of people who, as a result of things shutting during the pandemic, during lockdowns, became less active, lost contact with a set of social activities, stopped. These might have been older people who went down the local shop every day and that kept them mobile and active, perhaps went to a coffee morning, and all of that's changed, and that kind of has resulted in kind of greater acuity of need. Are there people who, we talked earlier about elective backlogs, where the impact of an elective backlog is, say, reducing mobility? So to help us understand what that kind of future demand looks like over the next 5 years, and is this a new normal in terms of increased acuity and complexity? The second is to help us prepare for social care reform in October 2025. So one of the things that the sector, local government said, is really needed a 2-year lead-in period for that social care reform. So if it's going to happen in October 2025, then logically you'd start preparing for it from October 2023. So to help us work that through and understand what changes in costs there might be for the local authorities, so that if it does go ahead and government provides kind of financial support to local authorities, we can match up that kind of level of financial support against the cost implications for the council. And then the third piece of work is to look for opportunities for us to change the way that we operate, to understand are there ways in which we can see people more quickly, are there ways in which we can deliver the outcomes that we want to achieve for people and the services that people need, but in a way that will cost less for the council, given the kind of financial constraints that the council faces. So they're doing that piece of work over the next 2 to 3 months. We'll have a product in September. We think that's what we're aiming for, which will kind of essentially tell us some answers to all of that. And sat alongside that, there'll be a kind of a plan about how we might go about implementing some of that activity, and a decision to be taken about whether we then work with them to help us move the implementation along more quickly. So we can bring those products back to this panel if this panel is interested in. Probably October would be a wise date to aim for, so have a level of confidence then we've actually got the product. Whilst the piece of work is primarily focused on activities of the council, there are some interfaces, so things like reablement and intermediate care services that support people with hospital discharge. We're asking them to have a particular look at those to understand whether there's scope to do all of that activity better. So we'll touch on, there'll be some touch points with colleagues in CHFT and with Mid Yorkshire Hospitals Trust, with Locala colleagues in particular. And I've had conversations, with senior colleagues in each of those organisations, and they will obviously support us with that piece of work. And then our demand modelling, I think, will be helpful for the system more widely, particularly probably for Locala colleagues, because some of that demand for social care services will be not dissimilar to the demand probably for some of the community healthcare services that they provide. So obviously we'll be, once we've got that worked through, we're happy to share that with the system more widely. And we did talk to colleagues briefly about whether we might do this as a bigger piece of work across the health and social care system like some places have done. But there's always a trade-off between doing something that's really, really big and joined up and it becoming so large that it becomes difficult to move at pace. And so given some of the immediate challenges in the council, we thought it best to take primarily a council phase, but we'll spot opportunities to work with NHS colleagues on that.
Thank you. Panel, do you wish to ask any questions about that?
I think it's probably worth just asking, when dealing with sort of any external consultancy, and you talk about this external commissioning of consultants to support the inefficiencies, it's just worth asking, what is the level of consultancy with current commissioners of that service? Because you mentioned that obviously one of the aspects they're looking at is around the impact of COVID. So there's two questions, I guess. This external consultant, in terms of geography and demographics, where have they come from and where's their experience lie? And secondly, that sort of level of consultancy that you'll have with current commissioners of the service, and how you'll work up together, how they'll partnership. So you're not coming into it blind, or they're coming in from a different perspective.
So they are a national organisation. What they are very data driven, so what they are looking to do is take publicly available national data, but because they've worked in a significant number of other health and care systems, they will have access to data which clearly they won't tell us anything about another named authority, but they'll be able to say, when we look at Kirklees and the demographics of Kirklees, what we're seeing here is similar to a comparator authority, or actually it's quite different to a comparator authority. So some of that will be getting us our data analysis. They next week start 3 days of work with a cross-section of frontline staff where they're going to go through case reviews and ask 150 is the target, and with those frontline staff just work through and ask them to talk a bit about what they've observed. They won't be talking about their own cases, but just almost do a peer challenge about, well, had we taken a different approach here, might there have been a different outcome? They will be working, interviewing kind of partner organisations and building a picture which is both about hard data but about insight into individual cases, feedback from frontline staff, feedback from partners. We'll also, because we're keen on co-production, we've got a co-production board, which is people with lived experience of using social care services and their family carers. They're keen to be involved in some of this work as well. So it'll be really about bringing a whole set of sources of intelligence together, but critically being able to compare that to other places in the country and say, because we know who our comparator authorities are, and they'll be able to say, yeah, broadly this looks in line with what we would expect of a place with the characteristics of Kirklees, or actually there's something going on here which is different, and different isn't good or bad, but is different, and this is why we think it is different, and this is what one might want to do about it based on knowing that kind of data about other places. And some of this is that we know as a council we've got some great colleagues in our data and insight services, but we're asking for an awful lot of analysis from them at the moment, and so the idea of bringing in someone who can do externally who can do some of that analysis is we can move more quickly on some of this.
Yes, thank you. Habibah, maybe.
Thank you. You have actually answered part of the question that I was wanting to ask. The other part is really that in terms of the analysis that they're wanting to undertake, you've included some of the service users and that, but what about ex-service users that might have come out of that social care setting for various reasons, whether it was a good experience or a bad experience? Would we be able to get their views included in this consultancy?
Yeah, and certainly if we look at, say, reablement services, which are short-term service, so they are, you're right, a set of services that people will use for 6 weeks or so and then move on from. They're going to be doing a number of things, so the goal of those services is to improve people's independence. But you could, so someone's perhaps had a fall, broken their hip, gone to hospital, had kind of surgery, comes out of hospital, has lost their confidence, needs support to get back on their feet and living as independently as possible. We want to test out, well, how effective have those services been in making sure that people don't need long-term care, that people can get back to doing the things that were important to them. And that's absolutely about looking at data, but that'll be about some of that kind of insight that we've got from talking to people, because we also talk to people ourselves about their experience of services. But the other thing we want them to be able to do is look at how well we perform compared to other places in terms of that bit. But are we targeting the right people? Because you could target 100 people, and 100% of them is fully independent at the end of that. But you have to ask, if you'd done nothing, what would have happened? And if you get the targeting wrong, you could pick 100 people, 95 of whom would have got back to living independently without the intervention. So whilst your intervention appears very successful, it wasn't really, because actually you didn't add that much value. Equally, there will be a cohort of people who you will not get back to being fully independent, and so it might look like you've failed, but actually they're people with very complex needs, and what you might do is increase their level of independent functioning. And that might look like you've been really unsuccessful because you've not got these people back. They're all people who still need a social care service at the end of your intervention, but they need less of it and they're able to live a better quality of life. And so we really want them to, and over years, reablement services have changed in terms of their targeting, particularly driven by changes in hospital discharge flows for people coming out of hospital with much more acute needs, much less well. So traditionally, these are services where people would have been discharged from hospital and would have engaged immediately. We're now seeing that people actually just need a week or two of home care to get well enough to get into a kind of more rehabilitative kind of activity, because people are still, pretty unwell at the point of discharge. So we want them to help us understand all of that. But it's a very long-winded way of saying that's a really good example of a set of services where we can understand people's experience having come through the service. For many of our social care services, people don't tend to exit the service in a way that they can provide feedback. So typically people have users of residential care, for instance, will use that service for the rest of their lives. But we absolutely want to get service user kind of feedback, including people who are no longer using those services, because we recognise that if you're using a service, you might be slightly more reluctant to give kind of critical feedback than if you're not using that service anymore.
Yes, thank you. Are you happy with that?
Can I ask, I don't know if you'll be able to answer the question, but what's the time scale for each stage? So in terms of obviously the identification, and then, how long are we looking down the line before we actually start implementing?
So they will... Yeah, their first few weeks are, so they'll have some initial hypotheses from just looking at publicly available data about Kirklees. What they're wanting to do is start to test out those hypotheses. So the case file order over the next week or so will add a dimension to that. There are some things where we already have a plan about how we want to change a service, and what we're asking them to do is almost just do an assurance function. So have a look at our plan and say, yep, that looks like, based on their experience of working in lots of other places, that looks like a reasonable plan of action. You might want to think about it at this. We'll get that feedback more quickly. Those things where they need to go and take the data, analyse data, do the case file work, go and talk to staff members, talk to people who use services, that'll take longer to get back and validate. But we expect something back from them by September, because one of the products we want from them, and this is why we went out to procurement exercise, and we had 3 organisations in the end who were interested in working with us, but we're really clear what we want is for them to say, here's a level of money, if you worked differently, here is a level of savings you could achieve, and that they, if they were to work with us to deliver those, would commit to delivering those savings for a fixed amount of fee on their behalf, so that in a sense there's no surprises. everyone's really clear up front what it might cost and what will be the value of that will be. And we, given the fast-moving financial position, we can bake all of that into the budget. And that's different to the approach from some other organisations which would have moved more quickly and given us a sort of a ballpark figure, but they wouldn't have been committed to it because they then take 2 or 3 months doing further work before they're absolutely willing to commit to a figure. And so it takes a bit longer, but what we get out of something, out of the end of it, is something which is, you know, everyone is kind of committed to.
Yes, thank you, Richard. Panel, have we any more? I'm getting awful feedback now because I can hear myself and I can hear myself twice. We're happy with that. Okay, you happy with that, Richard? You right? So we will now need to consider the golden threads that we've got, and we certainly have come across several of them. Workforce recruitment and retention, that's an ongoing problem, and it's both public sector and private sector. We are hearing and we are aware of lots and lots of issues about recruitment, retention of staff. There doesn't seem to be an easy answer, well, there isn't an easy answer to that. The different service providers are obviously aware of these issues. They do assure us that they're working towards combating them. Impact of COVID-19, I've got mixed feelings on that. We, as a society, we need to be moving on from COVID-19. There are still some legacy impacts, but I think they've been more or less subsumed within recruitment and retention. I think it's become more a staffing issue than anything else at the moment. Performance data to inform the individual strands of work. We're getting, at the moment, we've had very little about performance data, but having said that, we are at the beginning of the year, so to speak. Certainly, I'll be looking for more feedback and more precise feedback from different partner agencies. So we are aware of that. We'll be continuing to look at that. Inequalities in health, including checking the work being done to promote the range of services available to deprived communities and actions initiatives. We haven't actually touched on that as yet. We are aware of it. We will keep it to the forefront as we talk to individual service providers in individual areas. And I personally would like to see some sort of evidence of how agencies are attempting to tackle these issues, because there are very real issues about inequalities, and we do need to be not only aware, but we need to be doing our best to encourage agencies to address these inequalities. So we are aware. We've got half the golden threads going. We know the other half, and we're going to be picking up on them. We've got any comments on that from the panel? Any comments from partners? Thank you. So now it really just remains to do our dates for the diary, so to speak. So the final page of the agenda, the meeting dates, or eating date it says on mine, and where we're going to discuss the different items. Richard, I think you're probably best placed to lead
obviously
this.
it's not completely populated yet, and I made up, and I do apologise for, I think I mentioned joined up care going to November, and currently it's scheduled for September. But based on the feedback from the discussion today, I can confirm obviously we will be going ahead with the resources and the capacity and demand items at the August meeting. The brief has already gone out. One or two additional comments that have been made will feed that into the brief that's already been sent. And if you remember, what we said we would also do is include in the August meeting the discussion around the older people's inpatients transformation programme for obviously mental health services. So we'll have the 3 items for that for August. In terms of, I'll come back to September. In terms of November, we've currently scheduled in the discussion around maternity services. So we'll have the update for maternity services at that session. Plus, we'll have the item covering the joined up hospital services. So I think that's already been, I think, effectively agreed. And prior to that meeting, we'll try and make sure we got the arrangement for that visit to Pinderfields. And obviously we can have that discussion with Mid-Yorks as well. In terms of the September meeting, as I say, we've got the joined up care in Kirklees neighbourhoods. I noted that Richard mentioned about the adult social care item probably coming later on this year. The problem is September may well be too early, Richard, and we've already got November lined up, so we might have to consider pushing that into the new year. Would that, from your perspective, would that be an issue, do you think?
No, I mean, these things, time is never perfect. You either moved on a bit. If that will work, can be made to work.
So we might well schedule adult social care discussion for that early 2024 meeting. What I would say is, and I think we mentioned it at the workshop, is these obviously are the formal meetings that are actually in the calendar of meetings, and they're obviously all in your diaries. If there is a perceived need to have additional meetings for addressing any urgent matters, then obviously subject to your availability and your agreement, we can schedule additional meetings, and we can schedule informal sessions, and we will have communication electronically as well. So, for example, if we do receive information, updates, data, which obviously we think is important that you see, then we will send it out to you outside of the actual meetings. We are getting from, I know Calderdale and Huddersfield Foundation Trust, you're giving us a weekly update, aren't you, on operational matters, which will continue. So we will continue to send that through to you. And obviously, if there are any particular issues or matters arising from any information you get, if you let us know, we will liaise with the appropriate organisations to obviously try and address any questions or queries that you may have. Nothing further to add, Chair.
All right, thank you, Richard. Panel members, anything you wish to add? All right, well, just before we close, I do have an announcement to make, and it quite saddens me, but Richard, our panel support officer, is retiring. He's escaping from Kirklees. That's why he's got a big grin on his face. And this has been his final appearance with the panel. Still is a very experienced officer. He served in many different roles, servicing a number of committees, and some of which I have sat on. My abiding picture of Richard is the personification of professionalism and efficiency, exuding an air of calmness and unflappability, quite the opposite of me, which has helped this panel in particular, and other committees in general, go about their business calmly and effectively. It's certainly helped this panel very much. He's been a great help to me in my preparation for this present role, and it's made my adoption of this position much easier than it could otherwise have been. I'm very grateful to him for this. Richard's an in-depth knowledge of the workings of the panel, which has been invaluable to me. Indeed, at a recent meeting that we had with leaders of Calderdale and Huddersfield Maternity Services, I did refer to Richard as the memory bank of this panel, because he knows it all. And I'm very sorry to lose that memory. So I'm very happy to put on the record my appreciation and thanks to Richard for his help to me in particular, and his service to this panel more broadly. Thank you very much, Richard. And I think we're finished now, folks.